Hello, I am Stephen Beattie, eHealth Programme Manager with the Business Services Organisation in Northern Ireland. I'm here this morning to talk about our Northern Ireland electronic care record. It's an integrated care record across our whole population within Northern Ireland. It transcends geographical and system boundaries, providing a single clinical portal that all information relating to our patients and all of their medical records in one place, viewable by a range of different healthcare professionals. It started life back in 2013, so it's coming up to its 6th birthday in July, and we have over 25,000 users actively using this system across a very wide range of clinical disciplines, as I mentioned. It interfaces a range of different systems, so it pulls that information all together in one portal, in one place, so it saves our healthcare professionals a great deal of time having to access multiple different systems. Information was previously siloed in those different systems, so now that information is all available in one place and easily accessible to give that entire patient journey and picture of what's happening clinically with that patient. Some of the specific functionality that we've introduced on top of that integrated care record are things like electronic triage and electronic referrals. So within our GP setting, the GP will raise a referral electronically into the acute system, and via NIECR that is then triaged and immediately dealt with and put on the patient put on the waiting list, or whatever the most appropriate course of treatment happens to be. We have evidence of where in a parallel test the letter referral had arrived after we had already a patient with the referral received electronically and their first appointment already undertaken. So it has been a transformational aspect in its own right. The information then in relation to what's happened to the patient in the acute care setting is automatically transferred back into the GP setting and integrated back into the GP systems. Other pieces of functionality that we've introduced is our radiology ordering system. So instead of our users having to exit out of NIECR, go to a separate radiology system to place their orders or their requests, they can now do that all within NIECR. We've also introduced a range of care pathways, probably most prominently our diabetes care pathway, which fully integrates care in relation to all aspects of diabetes, all in one place across, again, the whole geography and multiple systems. And we've also introduced a patient portal, which is now able to share a lot of that rich clinical data with the patient themselves, get the patient more involved in their own care, and the patient is then be able to more actively input into their own goals, for example, that they would set in conjunction with the healthcare provider. The patient can also spot any data quality issues or any errors in their own record, which is also an important aspect of what we do. And ultimately, the information belongs to the patient, and that's important to have the patient access to that information. This is my first time at the Digital Healthcare Show. Very excited to be here. Already it's been extremely useful. It's great to hear what's going on in other places, speak to some of the suppliers and the vendors and some of the other providers in terms of what they're doing, and good just to expand our knowledge base beyond our own geography. It's also quite pleasing to be able to share what we're doing as well, equally. So it's a great collaborative platform to do that and to meet other people from maybe slightly outside of my own area as well, which you always learn a lot from that type of engagement.